I'm doing a training on the National Acupuncture Detoxification Association, or NADA, standardized 5-point ear acupuncture protocol. And I've been doing these trainings since 2008. I'm a registered trainer for the organization. But during 2020, I didn't do a single training. So the last time I did a training was before this month, was in 2019. But people are really seeing the benefit of this, and they really want people to be able to train. So Health Solutions reached out to me because they have some people they want trained, and they provided a space. And so I said, sure, because I went to look at the space, and it's large enough where we actually can do social distancing, and they have a thermometer at the entrance, so you can text your temperature, and we wear masks. So actually, my first training was the first week of April in Boulder. So I did a training for 16 people. And it worked out really well. We did great in terms of everybody being safe and working well together. And we've had some changes in the law in Colorado. Prior to 2013, only acupuncturists and physicians could use acupuncture needles. And so I was able to get a law changed. It took me 3 years to get it changed. We got a law changed that allowed licensed mental health professionals to be able to do this, because it's a very safe, effective, standardized treatment. You're not really an acupuncturist. You're just learning a standardized protocol. The laws have continued to change. So last year, there was an addendum to this that now we can train anybody. So I can train anybody who's considered a professional. And so in the last training, I trained several people who were peer coaches or peer mentors. So these are young people in recovery who want to give back and help their peers. And so I was able to train some of them. So anyway, I have this training this week in Pueblo at Health Solutions, and it's in their wellness center and on One Wellness Way. That's the address. And that's on the Mesa. If you go out 50, and it's just right there. And I actually have probably, I don't know, I have 20 people signed up. I think a couple of people may be dropping out early, but most of them are healthcare professionals. So most of them work in treatment facilities or they're private individuals. But it's really great that we can train pretty much anybody. Behavioral health is something that could be all-encompassing. Part of the problem has been that it's been isolated from medical health. In Western medicine, it's very much a reductionistic approach. So we want to identify the one thing that's the problem, and we're going to go in and fix that one problem, and then everything's going to be okay. And that doesn't work to me in medicine. The only area of medicine, I believe, if that's your approach, that you can go in and be successful is surgery, because that is what surgeons do. Surgeons identify the one problem they need to go in and fix, and they do successfully. However, this is kind of why I got into the ear acupuncture trainings, because I really like the approach of traditional Chinese medicine, where you're really looking at the entire person, mind, body, spirit. And it fit really well for me because I'm trained in addiction medicine. And that is kind of what we do in addiction medicine, is we look at the whole person. We look at mind, body, spirit, because drugs of abuse affect you physically for sure. They definitely can damage your body in many ways. So there's this physical approach to dealing with that. But it also can affect you mentally, psychologically, emotionally, and spiritually. And so when we're trying to help somebody, we address all of those. And so to me, that's what behavioral health is looking at the entire person and how it affects your thinking and your behavior and those kind of things. And so that's what we're working on in this ear acupuncture thing. Because as a psychiatrist, I'm trained as a psychiatrist. And initially, I was very much trained in pharmacopoeia. I was in a very biologically driven residency program where psychopharm was the answer. And I actually became really an expert on psychopharm. And I was the chief resident of the program. And so I went to a chief resident meeting that was a national meeting in New York at the time. And I found that I really didn't have much training in the other aspects like group therapy, psychotherapy, individual psychotherapy. And that was really kind of disturbing to me that there were all these. I mean, I knew psychopharm better than any of the other chief residents there. However, I didn't know other things that I think were really important. So I actually came back to that residency, and I stayed on as faculty when I graduated, and I became the residency training director, mainly with the intent of improving the training so that we actually had full training in all of the aspects. And over time in my life, I have become less and less enamored of psychopharm. And I think that we have way too much use of psychiatric medications, and we don't even really know what they do. And so I really support people trying to see if they can address psychiatric issues without medication. Or I spent a long time, last 20 years, I was the medical director for an inpatient treatment program, a 3-month-long program where people with co-occurring disorders, so people that have mental health problems and substance use problems, most of those people would come in with multiple psychiatric diagnoses that they didn't really have, but they looked like they had them because of the drugs they were using. And they had been put on many psychiatric medications. And so I spent a great deal of my time helping people get off psychiatric medications to find out that they didn't really need them. But that's really difficult because those drugs can actually change the way your brain functions. And so it can be really difficult to get off of them. And there's a really fascinating documentary that's out there right now that I really encourage people to watch called Medicating Normal. And that is very helpful for people to see. Maybe you don't want to go down that road. And if you're already down that road, you really need support, you need help to function with that. And what I found was when we started doing this ear acupuncture, because I started doing it in 2000, I came to this program, and this program was at the State Hospital in Pueblo in Colorado, to make it tobacco-free, because most of my career I've spent on trying to convince people that if you really want to quit using drugs, you need to quit using all of them at the same time, which includes tobacco, because then you're going to be more successful. And a lot of people didn't believe that, but I think more and more people are starting to recognize that that's absolutely true. And so when I came to the state hospital, this was in 1999, I still had this idea about psychopharm. I was still very much into that. And I was very skeptical about anything alternative because I'm a Western trained scientist, and somebody has to prove to me that they actually work. But I wanted to make this program tobacco free, and I heard that this protocol helped people with smoking cessation. And so I agreed to say, okay, let's do it. Let's try it and see. So we got trained in how to use it. And I just told the patients that this is to help you not smoke, because they would come in smoking a pack a day and they'd have to stop cold turkey. And we would use nicotine replacement therapy like nicotine patches. That wasn't that helpful. And so I encouraged them to use this ear acupuncture, and we offered the group 5 days a week. And I actually started collecting data because I needed to prove to myself that this actually worked. Over time, I was like blown away. I mean, this is a really helpful treatment, and it's not just to help people quit using drugs. It is a very effective treatment to help people learn how to calm down, deal with stress, and cope. It's not a standalone treatment. You can't put needles in somebody's ears and they change their behavior. But it really helps people relax. It helps us sleep. It helps with so many things. And that's why I do the training now. And I go over all that in the training. And I've actually published quite a bit out of our experience using the ear acupuncture. And I actually was using it to help people get off of psychiatric medication. The training is a 3-day long training. It's a 70-hour kind of training. 30 hours of it are didactic, and that includes reading the manual, which is a very long manual, reading things that I send people before the training, and then the 3 days of lectures and experiential practice. And then they learn the points, and then the first day they use each other, so they treat each other. And then the second and third day, we invite the public in, so they invite their family and friends. Anybody can come, and if they're willing to be treated by somebody in training with supervision, they can experience the treatment. But that's not enough, because what we require is 40 supervised treatments. So that's the 70 hours. 30 is didactic and 40 is supervised treatments. And usually they get maybe 15 during the training, and then they have to get the rest after the training. And anybody who has achieved the certificate of training from NADA and has this 3 letters after their name, which is ADS, which stands for Acupuncture Detoxification Specialist, can supervise people. And so they sign off witnessing the person doing the treatment. And once they've finished all 40, then the other requirement is they have to go to a self-help group of any kind, and then write a reflection paper about it. And I started doing that mainly because I was amazed how many people I was training that work in this field, the behavioral health field, who have never ever been to a support group meeting, even though they refer people to them, like AA and Al-Anon. And so I want people to go and experience what it is they're sending people to. I've gotten some really great papers, like amazing papers out of that. So that's basically what the training consists of. And then people can utilize this treatment protocol in many ways. And it's used in many, many, many places. One of the, to me, most powerful places is in a harm reduction setting, like needle exchange program. There's one in Pueblo who the owner has been trained in this. And so she started offering AccuDetox treatments to people that were coming in to exchange their needles. So, you know, they're actively using drugs, and they're bringing in their needles to get clean needles. And then they can sit in this room and get needles in their ears. And I saw some really phenomenal stuff happening where they have peer mentors that volunteer there in that needle exchange. And so I'd see somebody who had come in to exchange their needles, sitting with needles in her ears, and then asking one of the peers, how do I get off this stuff? Like, it starts the conversation about, you know, how can I get help? How can I get treatment? And I would see these people, like one person said, well, you know, I did Suboxone and this is how I did it. This is where I went. I did methadone. This is what I did. This is where I went. I went to treatment. This is how you get into treatment. And so it's amazing how it really starts the process of people starting to think about, you know, how can I quit? How can I stop? That's the whole purpose of this training, is to help people learn that you can actually heal from the inside out. And so we're trying to access your own natural abilities to heal. And that's what acupuncture does. That's what acupressure does. And the meditation is awesome. But what I found working with the mentally ill is it's very difficult to train somebody in mindfulness because you're asking them to sit still, just, you know, focus on your breathing. Don't let the thoughts bother you, you know, just let them pass through, no judgment. And so people that are hearing voices and, you know, having their mind race, that's hard. But what we found with the ear acupuncture is that is the perfect place to teach people, because it's, for many people, the first time they've ever sat still, like completely still and quiet. And so then they can start learning that, you know, this is actually something that helps. You know, I feel better. And then we're teaching people that you have your own innate ability to heal. Most research shows that if you're really going to change a behavior, you have to do it consistently for 21 days. And then it starts becoming ingrained in you. But yeah, if you just do it for a few days and then you're right back to where you were before, because what you were doing before, you were doing longer than 21 days. And so it's really kind of hardwired into your brain. And so it's learning anything new, you got to consistently do it regularly. I was going to tell you that I'm actually training 2 people to be trainers at this training. And one of them is coming from up Fort Morgan area. So she is somebody who works for Centennial Mental Health, and she has gotten this into many of the jails up there. So this is, she'd be a very interesting person to talk to. And then the other one is an acupuncturist from Denver who, so she's actually fully trained in acupuncture, but she has many other things in her background. She's kind of an amazing woman. Behavioral health has become more encompassing because what we historically have had this very strong separation between mental health and substance abuse, and they're interchangeable. Most people that have substance abuse issues have mental health issues, but they've always been treated separately. And that's why, like, the Circle program that I ran was so unique, because it was a treatment program that was treating everything at once. So that's why it was called for co-occurring disorders, people with mental health and substance use issues. However, like I said, I think everybody has those co-occurring disorders, some not as severe as others. And then there's the behavioral kind of addictions that never get addressed in substance abuse, like gambling or internet addiction or pornography. So those are kind of behavioral health things that really should be all encompassing. And so that's where the term behavioral health comes from. So it incorporates mental health, substance use, and then kind of like the behavioral addictions or the behavioral acting out. So yeah, it would encompass people with developmental disorders, behavior, so, acting out behaviors, those kind of things. So it's just a more encompassing term to use. NADA is not like in Colorado, we have one of the best laws in the nation in terms of anybody being able to learn to do this, and then they can do it without supervision. The different states have different laws. And so like New York, where it all started, this is where it came about, was in New York, actually has a pretty limited law, because their law only allows people to use it in substance abuse treatment and in the state-supported treatment programs. So I was there to do a training for the use in disaster situations, because that's another place that it's used quite a bit, is after trauma or disaster, to help people prevent getting post-traumatic stress disorder. Because one of the number one reasons people develop PTSD after a trauma is they don't sleep. And so they don't sleep well, and they don't then digest all those memories and process them, and it turns into post-traumatic stress disorder. So we found that if people can get this ear acupuncture treatment after a disaster, it helps them sleep, which then helps them process and digest their memories. And I couldn't train anybody except acupuncturists in New York. And so I did this training with another acupuncturist, just for acupuncturists to work in the Medical Reserve Corps. But because they didn't have a law that encompassed all of behavioral health, and it just encompassed substance use disorders, then that's why other people couldn't be trained. Anybody. In the training in Boulder 2 weeks ago, I actually trained a county commissioner from Prowers County. First of all, you should experience it. So you should, find a provider and go to one of these trainings as a volunteer, experience it, or find somebody who does it and experience it. And then consider if it's something you would want to pursue as, giving it to other people. A lot of these peer mentors that I'm training, because what I require, I have an application, and I can send you a copy of the application that they have to fill out. And then they're supposed to send me a brief summary of why they want to take the training and how they plan to use it. And I've got many who said, I got this when I was in treatment and it was so helpful. I really want to use it to help my peers. Or other people, that work in the field say they've seen it used and people just really benefit from it. I had some people that just say they just want to do it with their family and friends. They don't want to, actually do it for a job. job, which is fine too. Because if you're doing it for a job, you actually have to get malpractice insurance. I mean, because this is an invasive procedure. And so you have to, if you're actually charging people and you're saying you're a treatment provider, then you actually have to function as a treatment provider. But there are people that have taken the training. And the other thing we also cover are beads and seeds, which are acupressure points. And anybody can learn to do those. And anybody can use those. And anybody can purchase the beads and the seeds anywhere. Like Amazon has, you can purchase them. And they're also effective. Well, we have gold-plated magnetic beads that you can put on a point in the ear or multiple points in the ear. And they're on a piece of tape and they provide pressure to that point. And you can usually add extra pressure, like if you're really anxious, you push your ear. And so this is something we also cover in the training. And so that way, some people just elect to just use those. And that way they're pretty much covered, safe and everything. People tend to overdiagnose problems. I mean, I think everybody's got issues. I mean, we all have issues that we're learning how to cope. We're learning how to manage our life in general. And I think, life coaching is really helpful. I think therapy is helpful for people. People shouldn't be afraid of it. And I think what happens is people have a bad feeling and then they think, oh, there's something really wrong with me. And they go to a doctor and then they get medicine, which is a problem. And that's why I really support people watching this medicating normal kind of thing, because, people can have really life-changing, horrible traumas, but they do not have to have a mental illness because of that. I think part of the problem is when we say, yes, you've got a serious problem and we give you medicine, it kind of pins it down and then you're stuck like that. Steroids everybody's different in how they respond to meds. It depends on your own genetics and your metabolism. And some people actually become completely psychotic with steroids. And yes, it can be really problematic. Steroids can be very helpful for medical conditions used short term, but some people have worse reactions than others. So yeah, I mean, the steroids could have triggered some mental health issues for sure. But I don't think that has to be permanent. I mean, I think that's something that you can, actually heal out of, but you kind of have to stay away from those drugs.